Hi, my name is Dr. Joe Childs. I'm a board-certified chiropractic neurologist. On this DVD today, I'm going to talk to you about vertigo, disequilibrium, dizziness, and balance disorders. We're going to talk about our vertigo and balance disorder program that we do in our office to help patients with vertigo and all these different types of disequilibrium issues, balance issues, and how we help them without medications, without drugs, without surgeries and things like that. So we're going to talk to you about that today. How we've been so successful helping patients that have tried everything. They've been to multiple doctors, they've been to neurologists, they've been to all the special clinics, and they've come to our office and they've been able to find relief. We're going to tell you exactly what we do to do that. Before I do that, I'd like to tell you a little bit about myself. Again, I'm a board-certified chiropractic neurologist. I've been in practice here in Downingtown, Pennsylvania for 12 years. And a lot of people will say, well, what is a chiropractic neurologist? And what a chiropractic neurologist is, just like there's medical neurologists and medical orthopedists, in chiropractic you can continue with further education to specialize. And I chose to specialize in the field of chiropractic neurology. It's also known as functional neurology. And the difference between a chiropractic neurologist and a medical neurologist is we do neurological exams and things like that, just like your medical neurologist, but the difference is our treatment strategies. Medical neurologist is going to use drugs and surgeries, where what we're going to do is use specific stimulations for the brain, specific types of nutrition and metabolic protocols, which I'm going to talk to you about today on this DVD. A little bit more about me. Again, I'm fellowship trained in functional neurology, which basically means drugless neurology. I've been fellowship trained also in childhood neurobehavioral disorders, so I do see a lot of kids with ADD and ADHD, on top of some of the different vestibular issues that we treat in our office. I'm also trained in functional nutrition. Functional nutrition is different types of nutritional strategies that we do for patients with chronic conditions. I'm also trained in functional blood chemistry. I'm trained in spinal decompression therapy, spinal biomechanics, and prior to me becoming a chiropractor, I was an exercise physiologist. So that's a little bit about me. Let's talk a little bit about vertigo and balance disorder. So what makes us different than every other doctor you've seen? You know, again, most people have been to multiple doctors before they come into our office. So what makes us different is this. We treat vertigo and balance disorders metabolically and neurologically. So we treat the brain and we treat your internal bodily functions, okay? So metabolically, we're talking about nutritional care. We're talking about blood work, and we're talking about special labs to find out how things are going on in that respect inside your body. Here's the thing. If you're watching this DVD right now, it's either you or a loved one that is suffering with vertigo or suffering from balance disorders, or you may be afraid that one of these days you're going to end up in a walker because your balance is so bad. So what we're going to do in this video is we're going to talk to you about how we leave no stone unturned in discovering the reason why you have vertigo and the reason why you have balance disorders, whether you have one or whether you have both or what have you. See, medically, there's a very strict standard of care for treatment, meaning, you use antivert, you use these drugs, you do some vestibular rehab, you don't get better, and they can't find any tumors or strokes or anything like that causing it. You don't have MS or all these different hard lesions. You know what they say? You know what? Get a helmet. We're not sure why you have it. Just take these drugs. That's basically what's out there. There are things you can do to help vertigo. There's things you can do to help balance disorders, and we're going to talk about it today. So vertigo is a sensation of you're moving when you're really still. It's the bodily sensation of it's either the bodily sensation of you spinning or the environment spinning or the world tilting or you tilting and things like that. And what's going to happen is, in this video, I'm going to break it up into two parts. I'm going to talk about first the metabolic aspects of care, and then in the second part of this video, what I'm going to do is I'm going to talk about all the types of vertigo. I mean, there is multiple types of vertigo, all the types of balance disorders, and we're going to talk about the neurological base, the brain-based treatments that we do for patients with vertigo and balance disorders. Okay? So here's the thing, a couple statistics. Falls are the leading cause of death in patients over age 65, leading cause of accidental death. So it's nothing to mess around with. I mean, if you're having a hard time getting up in the middle of the night, making it to the bathroom because it's dark, because your balance is so bad, or you've got chronic vertigo, you need to be concerned about the fact that you could fall and maybe potentially break a bone, break a hip, something like that. It's nothing to be, nothing to take lightly. Your balance depends on good ocular motility, good vision. It depends on your neck, good healthy neck structure. It depends on the health of your feet and the sensations that you have in your feet, your inner ear, your cerebellum, which is the back part of your brain right in through here. Cerebellum is a processing station for balance and coordinated movement. I'm going to talk about all this in the second video, but the cerebellum is essential. Cerebellum could be affected by poor metabolic function. We're going to talk about that. It's also your inner ears. Your inner ear can be affected by an autoimmune problem. In fact, Meniere's has been studied to be an autoimmune problem. Your own body is attacking the semicircular canals and the otoliths, or the vestibule that you have in your inner ear. BPPV is a rock that floats around in your inner ear, a little piece of otoconia debris, which is like a kind of a little piece of calcium. The question is why does that happen to people? Well, there's some theories that it could be autoimmune. Okay, so Meniere's is pretty much definitely studied autoimmune. BPPV is probably going to come up autoimmune due to metabolic function. We're going to talk about that. So vertigo and balance disorders, they are metabolic and neurological conditions. Your brain needs two things to function well. It needs fuel and it needs activation. Fuel is in the form of glucose, oxygen, proper metabolism, proper function on the inside, proper chemistry. Activation is stimulations that your brain needs. Okay, so that's how we help people. We get their fuel right, we get their activation right. Okay? We're going to talk about on this one, we're going to talk about, in this part of the video, we're talking about metabolic. But the big thing I want you to understand is we treat you metabolically and neurologically. Metabolically means the fuel, the oxygen, the glucose, right? Neurologically means the stimulations. So let's talk about metabolic care. We're going to need to run a complete metabolic panel. We're going to run a lipid panel. We're going to need to run a complete blood count with autodifferential. We're going to need to run a thyroid panel, lipid panel. But Dr. Childs, I already have had all these tests. Doctor says they're all normal. Well, they're most likely not normal if you're still dealing with vertigo and issues like that. The reason why they look normal to your doctor is your doctor looks at what's considered the lab ranges. The lab ranges are the references that you see when you're looking at your blood work on the right-hand column. Those lab ranges are inaccurate. The reason where they got these lab ranges, most people don't even know where that reference range comes from. The reference range is the average of everybody given blood. So if you walk into a Quest and you give your blood and you see some of the people there, there's some pretty unhealthy people. The majority of people that are given blood consistently are pretty unhealthy. So you're the average of those. That's where those reference ranges come from. We use a much tighter thing. We use the functional lab values. The functional lab values are the average of everybody giving blood that doesn't have any symptoms, that doesn't have any vertigo, that doesn't have any chronic conditions. Does that make sense to you? So they're a lot more tighter. Okay, I'll give you an example. Again, and this is why your lab test may be normal, but you still feel bad, right? And this happens all the time. Dr. Childs, my medical doctor says everything's normal, then why do you feel bad? Okay, that's important to understand. So here's an example. Glucose. The functional range is 85 to 100. The traditional range is 65 to 110. So you can be 110, and that may be normal to your medical doctor, but it's not normal. It means you're moving towards diabetes. Or you could be 68, and that may seem normal. It's in the laboratory range, but that's moving towards reactive hypoglycemia and hypoglycemia, which can without a doubt cause you to be dizzy. And can make your cerebellum, which needs a lot of fuel to function, it may not function very well. Okay, to get patients that have chronic conditions, well, you got to get them well functioning metabolically. Okay, we run adrenal stress index. Adrenal stress index looks at your adrenal glands. Your adrenal glands sit on top of your kidneys. They are your stress hormones. It's a salivary test. You do 4 times a day. It measures your levels of cortisol. It measures your levels of DHEA. It measures your levels, and it determines, do you have too much cortisol from too much stress, or have you had such stress for so long that now your cortisol levels are burned out. And if they're burned out, that affects your blood sugar. It affects your function in your body. It causes insomnia. So this is a must test for patients with vertigo. The adrenal stress index is going to give us all types of charts and graphs. It's going to give us our cortisol rhythm. It's going to let me know what your cortisol is in the morning, your cortisol is at night, your cortisol in the middle of the day, and it should be at a certain reference range. Okay? We're going to run sensitivity testing. This is absolutely essential for patients, especially patients with Meniere's disease, especially patients that have BPPV, and really all vertigo cases, because here, and balance disorder cases, because sensitivity testing, we're going to test you for gluten, casein, egg, soy, and yeast. These protein molecules that are in food, you can have sensitivities to. And what can happen is they can get into your bloodstream, and your own immune system can try to attack these molecules, and that can create an autoimmune response. It can create inflammation in your body. And that can cause your body to create not only antibodies against the gluten and the casein and things like that, it can start to create antibodies against your own tissue. That is the definition of an autoimmune disease. Autoimmune diseases are caused by antigens that you continually put in your body that you're sensitive to. And that's one of the big causes. For instance, Meniere's disease, they found there is a lot of, not only do you have Meniere's disease, but you have thyroid antibodies at the same time, meaning you have antibodies that are attacking your thyroid. And almost always patients with Meniere's disease come up highly gluten or highly casein sensitive. We have to run the test. But Dr. Childs, my doctor already ran the test. He ran the test to see if I was gluten sensitive, and he said I'm not. Here's the trouble. The test that they run is only sensitive enough to pick up celiac disease. Celiac disease is the worst gluten sensitivity that you have. So like 80% of the people that are gluten sensitive don't come up positive with celiac disease. Okay? But they're still gluten sensitive, and the antibodies can attack not just your stomach. You don't have to have bowel problems to have gluten sensitivity. In fact, 80% of the symptoms are usually some other tissue in your body. It could be your neurons. In the nervous system gluten sensitivity has a high predilection for the neurons in your body. Okay? So we've got to run food sensitivity testing. We'll run what's called an intestinal permeability test. We have to test you to see if you have a leaky gut. You have barriers in your body. One of the barriers is your blood-brain barrier, your respiratory barrier, your skin barrier, but you have a gut barrier. The gut barrier is the gut lining, which keeps the food separated from the blood on the other side of the gut wall. Now here's the thing. You need to absorb through your gut nutrients. That's how you get nutrients. But if your gut is leaky, what will happen is the nutrients, when they're not digested, so here's the deal. The gut is kind of like a screen door. The only thing that should get through the screen door is air. The bugs should stay outside. It's kind of the way your gut should be. It should only be permeable to very small digested foods. So let's say you eat protein. Protein goes from, when it gets digested, it goes from proteins, the peptides, the amino acids. Amino acids can get through and your immune system won't even recognize them. But if your gut is leaky, peptides will get through. Peptides such as gluten, casein, soy, yeast, all that stuff will come down and it will get through your gut. And then your immune system is going to think that that peptide is a bacteria, a virus, or something like that, and it starts to attack it. And when it attacks it consistently over and over and over again, then that creates an autoimmune reaction, which means self-attacking of your own tissues. And that autoimmune reaction could attack your inner ear, cause Meniere's disease, can attack your cerebellum. In fact, we can run a test to see if you have cerebellar antibodies. Your cerebellum controls balance and coordinated movement. So if you have antibodies against your cerebellum, I don't care how much Antivert you take, I don't care how much rehab you do, the cerebellum's never going to work right. Okay? So we have to test you for a leaky gut because that leaky gut lends you to being autoimmune. It lends you to having more food sensitivities. We got to test you for autoimmune disorders. There's two parts of your immune system. I'll talk to you about that in a minute. But if you have an autoimmune problem, that means your own immune system is attacking yourself. It trumps everything. We've got to fix that before anything. Okay? So we need to test for that. There's the immune panels we're going to run is T and B lymphocytes, cytokine panels, and natural killer cell activities. We're going to run what's called interleukin 2, interleukin 10, interleukin 4, and TNF alpha. There's two parts of your immune system, Th1 and Th2. They need to be balanced. If they're not balanced, that's the definition of an autoimmune disease. Th1 is interleukin 2 and TNF alpha, and it's also your T cells. Your T cells are the immune white blood cells that go out and try to kill the antigen. So if you have gluten coming through, the T cells are what's going to do the attacking. If you've got a bacteria or a mold, again, T cells are going to do the attacking. The B cells, which can be tested by testing the cytokines, interleukin 4 and interleukin 10, the B cells don't do the attacking, they create antibodies. Okay? And so these areas need to be balanced. We have to find out if you have an active antigen. An active antigen is something like a parasite, a bacteria, a virus, a mold, excess yeast, fungi, protozoans, foods, chemicals, or heavy metals. So the foods are the food sensitivity testing. We have to run the test. It's a stool test. Okay? These active antigens can then create an autoimmune response because you have an attack on these active antigens. Immune dysregulation means your immune system is dysregulated because of long-standing anemia, long-standing high blood sugars, insulin resistance, trouble with your adrenal function, and that's called immune dysregulation. So the best indicator to see if you have an active antigen or something your body's trying to kill that it can't kill is what's called the helper-suppressor ratio. It's called the CD4-CD8 ratio. So when your body's trying to kill something, you have a lot of helper cells. So if it's up at like 2.5 or above, then we're really suspicious of there's something that your body's trying to kill that it can't kill. We can also look at your blood panels. That will also let us know that. Or we can do, if the ratio is below 2.0, we're thinking, well, this person has really poor immune dysregulation due to some other metabolic problem. We have to look at that through blood panels. We run a DNA stool ecology. DNA stool ecology will let us know if you have any parasites, do you have any molds, do you have buildup of yeast, do you have not enough healthy bacteria, do you have a leaky gut. That's what's going to help us there. It's very important in managing patients with vertigo, balance disorders, neurological conditions. We can test you for H. pylori. H. pylori is a bacteria that gets up into your upper digestive tract. That can be an active antigen that can spur along autoimmunity. We test you for inflammation, which is C-reactive protein and homocysteine. Very important there. We can test your neurotransmitters, which is looking at, we can not test them specifically, but we can run some surveys on you to find out, do you need dopamine support? Do we need to support your serotonin pathways? Do we need to support GABA? Do we need to sort of acetylcholine, support that? We can run hormone panels, which basically looks at your hormone levels, male hormone panels, female hormone panels. The trouble with these panels are they're really important, but if you have autoimmune, you have anemia, you have adrenal stress index that's off, you have all these types of issues, blood sugar issues, unhealthy levels of fatty acids, that's going to affect these hormone panels. So we got to get those things fixed before we look at hormone panels. Once we figure out what's going on, when we get a nice metabolic picture of you, what you're sensitive to, we find out what your blood sugars are. We find out, do you have any autoimmunity going on? Do you have a leaky gut? We're going to put you on specific nutritional protocols to heal your gut. We're going to put you on specific nutritional protocols to modulate your autoimmunity. What does that mean to you in your vertigo? Well, let's say you have a Meniere's syndrome and you get flare-ups. See, patients with autoimmunity, they get symptoms that do this, and that's kind of like Meniere's disease. So, one day you wake up and you're spinning and your balance is off, and the other day you're not so bad. That means you've got these flare-ups. Does that make sense to you? So we want to give you some supplements that are going to modulate the autoimmune reaction that's occurring in your body. We may put you on glutathione. Glutathione modulates the immune system. We put you on something that helps your body produce its own glutathione, and then we use a specific type of cream that's actually going to enhance the amount of glutathione in your body. It's a very important antioxidant. The whole goal is to get the fuel better so your brain and nervous system and your inner ears and all those things can start to function better so you can start feeling better. Also, patients with balance disorders, a lot of times they have neuropathy in their feet, and neuropathy is almost always due to secondarily due to food sensitivities or due to high blood sugar. So we have to get that under control. So the question is, have you had all these tests? Have you had these tests by your doctor? Has your doctor run all these special tests? The answer is no, they've not. And the bigger question is, why not? Well, the big reason of why not is because the medical doctor only does standard of care. Standard of care is, do you have MS? Do you have a stroke? Do you have anything that's life-threatening called heart lesions causing you to have the vertigo? If not, then you're on medications. And they may send you for some vestibular rehabilitation. That's basically it. They don't think outside the box. Now, if you're watching this video right now, the reason why you're watching this video is because nobody's helped you. Okay? So what always comes up when patients come into the office, they'll say, well, can my medical doctor send me out for these tests? The answer is no, because your medical doctor would have already sent you for these tests. Does that make sense to you? So we'll send you for the tests. And that's why you haven't had the test, because your medical doctor has not been trained to look at these tests. Dr. Durr and I go out at least once or twice a month and do specific functional medicine seminars that teach us how to analyze these panels. So they're integrative tests that we run. It's called functional medicine or functional nutrition. Now, the second thing we're going to talk about is neurological treatments based on specific neurological testing. So the video is going to switch over to another video that I filmed. In this video, I'm going to be going over all the types of vertigo and all the types of balance disorders. I'm going to go over the neurological cause. We already did the metabolic side. Now I'm going to talk about the neurologic side, and we're going to talk to you about how we rehabilitate parts of your brain that could be causing you to have vertigo or balance disorders. So thank you.